Comment reply. Can you please show me a video of how to clean extraction sites and immediate denture routine while healing? Okay, great question. I'm glad you asked. Do not clean those extraction sites. And by saying that, I mean like don't try to clean out the holes. Don't try to remove the blood clots. Do not try to disrupt those sites at all, except for to gently rinse with water, and just let that water roll out of your mouth into the sink. You do not want to try to spit the water out. You do not want to create any kind of suction that would dislodge those blood clots. Those blood clots that are in those extraction sites and the holes, those are your body's way of healing from the inside out. Your body is depositing new tissue cells there. So you don't want to do anything that's going to disrupt that and interrupt that process. I know that it's disturbing to see the blood clots in there, and I know from personal experience when I had my wisdom teeth pulled out when I was a kid, I felt like, if food got in there, then it needed to get out of there. I felt like my body was going to trap it in there. And oddly enough, my dentist gave me a syringe. I don't remember that he told me to do anything with it, but I assumed it was to clean the extraction sites, which turned out to be a really terrible mistake for me. Every time I ate and I got anything in those extraction sites, I was squirting it out and cleaning it out, and I got a horrible case of dry socket. It got infected. The dentist had to go in and remove all the dead tissue and debride that and then pack it with gauze, and it was a horribly painful process. Bad experience. So I wanted to make sure that I came on here and I answered this question for you, just in case you are in this process and you're getting ready to do that. Please don't do that. It's important to keep those places undisrupted. And that is why, immediate dentures are really beneficial in other ways, but in this way that they act as a bandage. They go over those extraction sites and they keep those blood clots intact, protecting those extraction sites so that your body can heal. I hope this helps. As far as cleaning the dentures, I really don't have my patients focus too much on buying a bunch of dental cleaning products in the beginning, because I want them wearing their dentures for the first, 72 hours or so, 24 hours a day, because that swelling would outswell the parameters of their denture if they remove the denture for more than just like 10 minutes. So I want them in their dentures all the time for the first few days. After that, at about a week to 10 days out, I put a soft reline in there to tighten the dentures back up. And that tissue conditioner, the soft reline, is usually a white or pink soft material that goes in the denture. If you use harsh denture cleaners with that, it can cause that material to degrade. So again, I really don't I prefer to have my patients soaking their dentures in a strong denture cleaner in the beginning. I just advise them to use dish soap to give the denture a nice scrub, scrub it, especially on the outside where the teeth are, but on the inside when that material is still very soft, that temporary reline material, very careful, just rinse that off until that kind of firms up after about a week or so. Even then, I wouldn't really soak it in a chemical cleaner, any kind of denture cleaner. I would just soak it in water. In the beginning, when it's very soft still, that temporary reline material, you don't want to soak it in anything because it can change the dimension of that material if you even soak it in water during that first week or so. So I hope this helps, and if you have any other questions, drop them in the comments. All right, have a great day. Bye-bye.